Magandang araw mga kapitbahay, kabalen at ka-CSA. Ito po muli Dr. Contessa Salvador ng CSA Certified Skin Authority. Our topic for today is how to enhance beauty in 30 minutes. How to look fresh and young looking all the time. This is one of the common anti-aging treatments that we use nowadays. This is the so-called dermal fillers. We will be showing you procedures and we also have special guests. So come and watch the show. We are privileged to have with us an expert in dermal fillers. He's a graduate of the School of Medicine de La Salle University. He's also a diplomate in the Philippine Academy of Clinical and Cosmetic Dermatology and also a fellow of the Cosmetic Surgery Institute of Manila. So let's welcome Dr. Sidney Koo. Okay, nowadays, some people are coming into the clinic wondering what are dermal fillers. They've been hearing it on the television, on the internet. So, Dr. Koo,
Yes.
may we know what are dermal fillers?
Dermal filler is one of the most in-demand procedure that we have right now in the country. This dermal filler is made of hyaluronic acid, which is non-permanent, but it also comes from a non-animal stabilized product, so it's very safe, no allergic reaction. Though it is temporary, so you have to keep on injecting it maybe once or twice in a year. But this is a very nice product. It's a revolutionary product. When we inject on the patient, we have an instant result for the patient and without any downtime. Let's say, for example, I want to do a little bit of augmentation on the nose of the patient and I don't want to do any surgery for it. I could do it right now and the patient can attend a party afterwards. So it's very safe, very easy, and it's very in demand.
So, doctor, you're saying dermal filler is made of hyaluronic.
Exactly.
What's hyaluronic, doctor?
Well, hyaluronic acid is something that we have in our body. They're all identical in any species. Hyaluronic acid is something that we produce in our tissue that we have when we were born, but actually kind of disintegrate or kind of get absorbed more as we grow older. So we need to replenish this. So one of the products that was created was dermal filler that is made up of hyaluronic acid. So you inject it, put it on the face or put it any part of the body, then it will create a shape that you want, or we call it contouring.
Okay.
Yeah.
So is it same as that of the, like you said, hyaluronic filler? Is it like a collagen filler you put into the, like any part of the face, something like that?
It's totally different because
Okay.
first, the hyaluronic acid that we inject, this is the thing that stimulates collagen production naturally.
Okay.
And aside from that, there's no synthetic part of the hyaluronic acid that we inject on the face of the patient or on the patient itself. The collagen part that you want to inject, as far as I know, the body itself has a collagen itself. So you just need to stimulate it, have it produce on its own. So it's totally different thing.
Since you have mentioned that these are also present in our system, these
Yeah.
are natural products.
Right.
So it is something very safe. It is something that no side reactions at all.
Yep. It's actually very safe. The reaction usually you'll be more beautiful.
Wow,
Or
I
you
like
have
that.
more things that you can do with your augmentation of the face. You wanted more of a lifting cheek. You have more chin, more nose, those sort of things.
So doctor, with
Yeah.
your patients, what are the usual kind of which part of the face you do fillers?
Okay, it depends. Depends on with the younger generation. They would love to have more of the cheeks, the chin, and of course we're Filipino. We're not so gifted when it comes to the nose. Those who want to do some of the nose without having to undergo surgery, they would want to prefer maybe do some injectable first, get an idea how it looks like, then afterwards go to surgery.
Okay.
So it's not really to prevent surgery, but
Yeah.
to go to get an idea
Yeah, that's
of how
right.
it looks like. So that's right now. But for the elderly, as we age, as you know, we become more dehydrated. The skin
Yes.
becomes more dry. Then aside from that, the fat on the face, we kind of regress.
That's
Goes
right.
down, goes a different direction.
True.
So we want to replenish that by putting hyaluronic acid or dermal filler to give you the hydration, the volume that we need.
Correct.
Yeah.
Is there a particular age, like me, like what
Yeah.
age right now I can
you
have a
don't-
filler?
You don't need any filler.
Oh my
Yeah.
goodness,
You don't
doctor,
need
thank
any
you.
filler. Yeah.
Is there like a certain age for patients who can have fillers or who cannot have fillers?
Okay, with the filler, it depends. If you want to use it for purposes for aesthetics, usually we have an age of 18 years old. And
From
above.
18 they
Yeah.
can have already.
Yeah. But you can do it earlier. If
Okay.
you like. Okay, genetic will give you an idea as how soon you want to do it. But
Okay.
how old you want to do it, as long as you want. Because this is natural. So there's really no limit to it.
Okay.
Yeah.
And also there's another question from some patients. How long does this filler may last?
There are different types of filler
Okay.
right now. There is some filler that will last for 6 months. You have to redo it, and it will last for 9 months, 12 months, 36 months, 24 months. It depends on the type of filler that you inject. But aside from that, the important thing is how does the patient react to the filler? Because let's say this is like water or hyaluronic acid that comes natural. If you go on diet or you go on marathon or you go on some extracurricular activities that
Yeah.
demands a lot of your energy,
And
this
then-
filler does not last longer. It just
So around
lasts longer than
from-
what is predicted to be.
Like in a year, you
My
still
patient,
have the
actually, I tell my patient to come back at least twice a year.
okay.
Great.
So retreatment
Yeah,
2 times in a year.
retreatment, but if you use, let's say, 1 box on the first treatment, the second treatment may be half. It becomes lesser and lesser and lesser.
So what do patients expect during the procedure?
Well, they expect a lot.
A lot.
A lot of changes on the face, the contour, the projection, even the skin tone. I always tell them that when you do a dermal filler, since it's hyaluronic acid, and one of the characteristics of hyaluronic acid is to recruit a lot of water. So I tell them to drink a lot of water, be sure to hydrate, and you can see the difference in your face.
Wow, it's a water attractant molecule. So some patients are also kind of like afraid of, oh, will I look different after the procedure? Will it still be me? Or is there a drastic change?
I always describe dermal filler as the only product out of the market that really can give you the instant beauty. Because I could
Wow.
really do it, then you can really look different afterwards. Let's say in a few minutes. Yeah. We even have a slogan where you turn back the beauty in 30 minutes.
Wow.
Yeah, make you look younger.
Instant beauty in 30 minutes.
Or less. actually.
Wow. So a lot of our viewers would love to do that.
The expectation is different from everybody. They
yeah.
want to look younger, other wants to look more pretty, the other looks less stressed, those sort of. Sometimes we do dermal filler also for other parts aside from the face, such as the hands.
Hands,
Yes. The-
neck.
Yep. Yep. Any
Okay.
part of the body
Okay.
that needs some more volume, or some
Okay.
symmetry, or some contouring.
Okay. Is there a downtime to the procedure?
If you are a healthy adult and you're not taking any blood thinners or any
Okay.
medication that will contribute to bleeding, there's no downside for it.
So
But
they
like I
can
always
go
say-
back to their work
Yep,
after
yep. In other countries, it's like an afternoon treatment. Okay, you want to do
lunchtime
it-
treatment.
Yeah, it's an afternoon treatment,
Yeah.
or lunchtime treatment, or after work treatment. You want to attend a party, you can do it like, there are other procedures you want to do it like a week before the party, a month before the party. This procedure you can do it a few minutes before the party.
Wow, I can do that if I have to attend a party
Yeah.
tonight, huh?
You can do
Any special precautions for the clients after the procedure?
I just tell the client usually to drink a lot of water.
Okay.
Avoid to put makeup for a few minutes
Okay.
because there's a hole there when we inject. Then if you want to do other treatment,
Mm-hmm.
make sure to consult your doctor first as to what treatment that they want to avail after the procedure.
Yeah, we also advise them to avoid like sauna or hot showers.
That's okay.
Yeah, that's okay,
That's
yeah.
okay. No, there's a totally different thing. But of course, we want to hydrate the patient. The thing that's probably the worst that I could tell the patient not to do afterwards is just like, for example, I do the nose. I don't want you to sleep on the nose tonight.
Ah, okay, of
Yeah.
course, definitely.
Yeah.
So,
No
like for
pressure.
example, if you do the nose, if you
Yeah.
do a nose filler, because they're wondering if will it be kind of like move to another part or will it change or be deformed?
That would really depend on two things. One is from the patient and one is from the doctor. The doctor is how did he or she inject it.
Mm-hmm.
Okay, the product will always tell you that one product is superior from each other, compared to one another. But the thing is, it's how much you put and was it put properly. That would describe or that would give you a prediction as to is it going to migrate. We use the word migrate. It's like transferring from one place to another.
Wow.
Not really. Not really.
So,
Not really.
okay. So, any like trusted brands that you would want to share with our viewers?
The brand is just one factor, actually. But right now, the one that I talk more for my fellow doctors and for my patients is actually Restylane, and it is the gold standard. And say the gold is the first filler that
Yeah.
was ever made. It's made from Sweden, and I think it's carried by Dermal, a trusted company also in the Philippines.
Okay, folks, there you go. We are so privileged to have Dr. Sidney Koo with us to share, to give us informations on dermal fillers. So if you have any more questions, actually, we will be willing to kind of receive any text or any like questions through the internet, our Facebook, okay? So thank you very much, Dr. Koo,
you.
for
Thank you for
that
having me.
very wonderful
Thank you.
enlightenment to all of us. Okay, thank you so much. With today's CSA episode, we are highlighting a non-surgical, minimally invasive procedure which we call dermal fillers. So I have with me right now Dr. Marivic Alfaro. She's a specialist also on fillers. So we will just be discussing on what were the procedures done on our two clients today. So Dr. Alfaro, any words?
Oh, it's my pleasure to be here again. Thank you very much for inviting me over. And I was able to witness the procedures that were done today, and they were really great. So,
Yeah, with the first patient that we have, Miss Rowena, she's actually a 24-year-old lady. What Dr. Koo did was on the nose area. Any kind of like comment on the procedure that we have seen today, Doctora?
yeah, the nose was great. I think Dr. Koo injected like only point,
Yeah, I think 0.2
yeah, 0.2
ml.
ml, and
Yeah.
it was a great
Yeah.
difference.
Yeah,
The bridge of the nose was lifted.
that's
and,
right. And it was really instant lift of
Yes.
the nose. Imagine
In less than an hour,
non-surgical,
30 minutes.
okay, no knife, it's just the needle a very tiny needle, and the patient was so comfortable, as if like there's nothing being done. Okay, so and the procedure was done in a short period of time. Imagine ilang minutes lang yon, doktora?
Less
Diba?
than 30 minutes.
Oo.
Yeah.
So, this is a very good procedure for those thinking of doing like surgical rhinoplasty. Before they do that, they can see first, like if it will look great or it will be good on them to have some lift of the bridge or correct the nasal tip. So, it's really, really such a very, very safe procedure, at the same time, natural substance ang ginamit nila dun sa patient, di ba, doktora?
Yes, at hindi lang yon. Pwede rin ito gawin sa mga kliyente na 18 years old and above. At sabi nga ni Dr. Ku, safe ito even to clients who are younger than that. But ang ating Restylane ay approved usually
Yes.
sa ating 18 years old clients
Yes.
and above.
So these are very safe, clinically proven products, okay? I myself, Doctora, I wanted to do that nasal contouring also, kind of augment or add a little bit on my nasal bridge. Pwede ba ako, Doctora?
Hindi mo na kailangan.
Oh my God.
Maganda ng nasal
Yeah.
mo. Pero that's a very good idea. Yung mga nagpaplano na magkaroon ng rhinoplasty or
The surgical
procedure sa kanilang nose to augment their nasal bridge, maganda na subukan mo ng Restylane injection
That's right.
para for a trial. Anyway, ito ay hindi naman permanent just
Yes.
in case.
Yeah.
Kung gusto nila ng permanent surgery.
Yeah, how long will the filler last dun sa
Usually, according
nasal?
to Dr. Ku, it varies. Depende
Yeah.
sa reaction ng kliyente sa
Yes.
sa filler. Usually, it could last a few months to even a year or two.
Yeah, he mentioned they can do retreatment
Yes.
after 6 months or a year. So they can add a little bit more of the filler.
Yes,
And
that's
so it's a wonderful thing to try. So good for Rowena. She has a very wonderful contoured nose. And the second client that we had, she's Jessie. She's a Korean actually. And she's 37 years old. So yung kanina 24, and then we had a 37-year-old female Korean. And before Dr. Ku did the procedure, there was an assessment that was done on the client. Kasi he had to check ano yung mga parts of the face that we need to augment or enhance. Actually, they're both beautiful. It's just enhancing the beauty that they have already. So with Miss Jessie, Dr. Ku worked on the cheek, both the cheeks, and also yung temple area. So, ano yung comment mo, Doktora, dun sa ginawang procedure kay client number 2?
So, immediately after the procedure, makikita mo na talagang naging prominent yung kanyang mga cheekbones at saka yung kanyang temple area.
Yes.
Meron siya initially, meron siyang indentation sa temporal area.
Yeah, the
at
one
saka yung
here.
kanyang mga lines
Mhm.
na glisten
Yes.
after the procedure.
Yeah.
Basically, walang downtime.
Yeah, that's a very good procedure kasi some of the people here, they work every day. They don't have time to kind of rest at home. Like sa surgery, there's a downtime, matagal, nagre-recover pa sila. And then, Dr. Ku actually augmented the cheekbone because he did the assessment on Jessie, and it's more of adding volume on this part, make the cheek look fuller. And then also, because the temple area, I noticed nga, before the procedure, dented. Pero yung dito. But after he injected the filler, the hyaluronic filler into this part and into this part, there was a drastic improvement. Kasi what I noticed, nag-lift yung face niya, and the face became there was the luster, more of an energy on the face, more of a glow, and she looked younger. And she looked younger. And targeting also yung mga lines dito,
Yes.
crow's feet can already be targeted with that filler on this side.
Oo, kasi yung filler, actually, ililift niya yung skin.
Yeah.
So, kapag nag-lift yung skin, nababawasan yung lines.
Okay.
Yeah.
Kasi
So there's-
filler, yeah, you
Yeah.
fill in a space beneath the or below the skin, okay, and then you lift it, and then the face looks fuller. Wow, it's such a wonderful, wonderful product, a beautiful technology. I think it's from Swiss yata ang product na to, made in Sweden. Is that right? Okay, it's an international product. So, there you go, folks. We have kind of given you some of the explanations on the procedures that were done on our two beautiful ladies. Again, thank you very much, Dr. Alfaro, for joining us with our CSA episode on dermal fillers. And Dr. Alfaro is with us here. She is one of our consultants at CSA Derm Center. So you may visit, you may want to consult with her. She's our consultant on weight loss. So we had her last time on one episode on how to lose weight. So again, folks, thank you very much. This is Dr. Contessa Salvador, your host here in CSA Certified Skin Authority.